Hello, I'm Janice Karin, Director of Policy, Technology, and Innovation at the Massachusetts Health Data Consortium, or MHDC. I run our Data Governance Collaborative, also known as the DGC. We start each of our weekly meetings with a series of industry quick updates to learn about new and proposed regulations, laws, standards, industry initiatives, and other activity. Join us for this week's updates. Go ahead and go to the first update if you don't mind. So there was a big announcement yesterday from ARPA-H for what they're calling the Universal Patching and Remediation for Autonomous Defense, or the Upgrade Program, related to hospital cybersecurity protection. It is an ambitious idea because it has several phases to it. The first two are pretty standard. The first one being creating tools for IT teams to better defend hospital environments, so particularly aimed at hospital environments. The second one is to probe models of digital hospital environments for vulnerabilities to help. Obviously, that will help create the tools and help hospitals defend themselves. The third one is where the ambitious idea comes in, which is a concept of automatic procurement or development of patches needed to remediate discovered vulnerabilities. So designing the idea is that they're trying to design a system that automatically defends itself when there are attacks ongoing, automatically clears up vulnerabilities, automatically takes critical patches and applies them without human intervention, which is an interesting idea. I'm not convinced we're quite at a point where this is, even if it were doable, necessarily a fabulous idea. There are a variety of reasons why someone would not choose to apply a patch immediately or apply it directly into production without trying it out in some type of staging environment first. So I am a little bit concerned about this concept, but since it's just looking to develop it, I think that's a reasonable thing to at least explore. I would just be concerned about I think it would require a whole lot of testing and thought about how it's implemented and options to deploy it to a staging environment first, or I'm not sure exactly, which defeats some of the benefits of it if it's not automatic. So I think that there's a lot of thought that needs to go into exactly how to make a program like that beneficial while reducing the risks of non-human intervention for things like that. So it'll be interesting to see what they do and their plans in that area. So in order to work on this vision, they're going to put out proposals in 4 different areas. The first one is a vulnerability mitigation software platform. So a platform that can basically be used to serve out different patches or mitigation tools and sort of be the backbone behind which that type of environment would operate. The second one is basically in developing test beds, mimicking different hospital environments that would be places where they can test out, do some testing, figure out what the right vulnerabilities to look at are, things like that. And then the third one is on auto detection of vulnerabilities. And then the fourth one rather, and this is again, we're starting to get into, are we at a point where this is a good idea yet territory, at least in my opinion, auto developing custom defenses. And again, I would say, just from my perspective, before I open up the floor, I think auto developing them is fine as long as there are guardrails and protections around them. I think auto development followed by auto deployment is probably a bad idea. So I don't know if anyone else would like to comment on this, but this is a newly announced program from ARPA-H that is at least interesting and definitely ambitious. Anyone have any thoughts? Anyone disagree with my characterizations or think that I'm being too much of a Luddite or cautious person?
I agree with what your feedback and comment, and Janice, this is Healy.
Yeah. All right, so I think it's just something interesting to see what happens with it. I don't have any problem with it being explored as an idea. I just don't think we're there. I think that we have a long way to go before I would be comfortable implementing anything like this. All right, well, if no one else has comments or thoughts, let's go ahead and move on. ONC has put out a decision support intervention guide that's based on the certification criteria for DSI outlined in HTI 1. It has a lot of, it's about 30 pages long. It has a lot of material. It includes definitions of relevant terms, an overview of the certification criteria. One thing that I thought was particularly interesting and useful were there was a sort of a table that had examples of predictive DSI and then a table that had examples of non-predictive DSI to give some sense of what falls into each category. And I thought that was helpful. And also, one of the things that they did was they took pieces of the regulation. This is a very dense regulation that required a lot of real effort to work your way through. And so one of the things that they did was they took sometimes just a sentence at a time, sometimes paragraphs or sections, but they sort of presented technical criteria in a call out box, and then they discussed it in more friendly terms and more less technical language around it. And I think that was helpful as well. They also talked about the required source attribute support for DSI in terms of what has to be done for certification and some of the risk management requirements. And then they had several addendums, including US CDI support required for DSI. And it's, don't get me wrong, this is still a dense, complicated document that deals with a lot of really detailed stuff. But I did find, after I spent a little bit of time with it, that it was more approachable than the regulation itself or the presentations that ONC has done about the regulations, which tend to sort of use the same type of language as the regulations and sort of not go into a lot of discussion and other terminology around it. So I think this is definitely a forward step kind of guidance document that I think would be helpful for folks working in this area. I think there's still more work to be done to make this really accessible, especially as I think one of the goals here is to have it be accessible to the people. One of the stated goals of the DSI criteria itself was to have the DSI be understandable by the people using it, not just the really technical people. And even just sort of as a sign of that, like they're not at that point. Like I'm really well versed in this stuff, and it's still an effort for me to slog through even this guide, even though it was an improvement. So I think that it definitely, it's definitely helpful. It's definitely a step in the right direction. I applaud them for putting it out there. I recommend that folks look at it if this is an area that you're working with or interested in, but it's not going to magically take this super dense, really complex, long regulatory section and make it, and just clear it all up and make it super obvious in one step. It's a step in that direction. Any comments or thoughts or questions there? All right, so let's go ahead and move on. ONC has two blog pieces that were kind of interesting. So the first one is, this is very short. It's basically a nurse's perspective on HTI 1. And what it basically has is 3 things that the nurse thinks are likely positive outcomes and 3 things that are potential challenges. And there's about a paragraph on each. It's very high level. But I think the one thing that was interesting was that isn't necessarily something that I think of as an outcome of the HTI-1 rule per se is the streamlined communication among healthcare entities. I think of that happening more from the CMS rules. And I guess it's predicated on having certain certification criteria, but I believe that certainly the underlying certification criteria of all the rules we have so far, other than specifically related to prior auth, which isn't covered by HTI-1, were present in previous certification rules before HTI-1. So I think it's interesting that she called that out as a potential benefit of HTI-1. Although I think that maybe just generally having more conversation about it is, and therefore more awareness of the fact that there is back-end communications going on. So the challenges that she called out are, again, not things that are surprises to anyone, but do sort of reflect the more hands-on clinical view, because in addition to the data privacy and security challenge, which is just sort of a general challenge with everything, the two things that she talked about were workflow integration and making sure that technology changes and updates are really integrated in with the daily flow of how they do their work. And then training and optimization, making sure that there is a sufficient amount of training, and also but balancing that with optimizing the way time is spent and optimizing the way things are done so that care isn't jeopardized. And I'm reading between the lines here. She didn't go into that level of detail, but it seemed to me that part of her call there, and the reason why this wasn't a potential challenge, was I think part of where she was going. And again, I don't want to put words in her mouth, but I kind of am going to for a second. So this is me taking what I got out of what she said more than exactly what she said, is that and this is true in all organizations in my experience, there's they don't necessarily have a balance between scheduling time for training versus the time needed to do the job. And so having training is important, but equally important is making sure that it's done in a way where it's not just an extra on top of everything else that they already have to do that they don't have time to do, I guess would be. And then that may be me reading too much between the lines or putting personal experiences at different places into reading experiences I've had or things other people have said into what she wrote. So you might want to take a look at the piece and see if that's also what you get out of what she said there. But that's sort of my reading into why that's a potential challenge. I thought it was interesting. I didn't think there was anything particularly earth-shattering. And I would say that the training and optimization is probably the only one that was sort of, I wouldn't say new, but not called out fairly regularly might be the right way to phrase it. But if you're interested in that perspective, definitely take a look at the piece. Any comments or thoughts or questions there? All right, well, then let's go on to the second one, which was written by Mickey. And it's talking about the intersection between information blocking rules and privacy laws. And this was prompted by the recent finalization of the reproductive health rule that requires not exchanging reproductive health data under certain circumstances, and also requires getting an attestation for the intended use in certain circumstances. And so he points this out in 4 things, but they're really kind of three big areas. So we've talked about most of this before, but the precondition is a new thing because this is the first time that that's really been an issue. But we've certainly talked about items 1 and 2, which is that the information blocking rules don't change the laws and don't change the requirements to follow the laws. So privacy laws, even if they're local laws that are just in your jurisdiction and this is a federal rule, you're still expected to obey the privacy laws. And in fact, there is a privacy exception to information blocking. It's one of the reasons why it's okay to say no to a request for information. and it is explicitly, sending it to you would violate a privacy law is absolutely on its face, end of statement, a reason that you're allowed to say no. And that which sort of ties into the second item, which is that, again, someone who says no when it would violate a law is not information blocking because of that exception that I was just mentioning. And then he specifically calls out, and again, this is sort of the new situation because this is the first time that at least we've encountered a precondition that requires you to get an attestation of use before sharing information. So if a law or regulation or rule places preconditions on sharing information before you're allowed to share it, then the information blocking rules would allow the actor to take those reasonable and necessary steps to get that precondition met before sharing the information. So again, here you're supposed to, for the reproductive health rule, I don't remember the exact wording or the exact conditions, but you have to attest that you're not using it for one of the forbidden uses. And so if you make a request for that data within certain groups, if you make a request for data, you have to attest that you're not using it for instance, to pursue an investigation against someone for an action they took that was legal in the jurisdiction they took it. So if someone goes to a state where abortion's legal and they get an abortion there, you have to attest that you're not requesting their abortion records in order to investigate them for having an illegal abortion if abortion is illegal in your jurisdiction. So requiring that attestation to be in place before you release the information is not information blocking. So again, there's nothing like earth-shattering here. It should all be self-evident. It really was pretty inherent in the information blocking rules. But the information blocking rules themselves are some of the more opaque areas of regulation, and ONC has real limitations on the type of specific guidance they're allowed to give. They keep requesting in the annual budget that they be allowed to talk in more detail about specific cases, but they haven't gotten that authorization yet. And so they tend to give these really generic, general guidance whenever it's information blocking. So the fact that they went out and were this clear, and this was a very clear blog piece, I think is just, this, and I would say this is also an area where the information blocking rules themselves are pretty clear. So that may be part of it. But just the fact that it was this clear and this blunt, this is the rules, this is all true, you should follow the laws. And if you follow the laws, you're not information blocking. I thought was a good thing and a good use of the space and the couple of minutes it took me to read it. So anyone want to comment or have any thoughts there? All right, then let's go ahead and go to the next slide. If you'll pause there for a second. I hope you learned a lot from our quick updates. If you're interested in finding out more about the DGC and its other activities, email me at dgc@myhealthdata.org. That email address is also on your screen.